Welcome back, everyone. Hopefully you're enjoying the health tips that we're putting out about once a week. Getting a lot of good feedback and comments as far as everybody talking about the health tips, saying they're helpful. So that's always good. If you have any ideas or questions you want to ask, make sure you include them in the contents or the comments, and I'll try to get to them. And what I try to do is include questions that patients ask me on a daily basis in practice. So I see those are what people are interested in and questions that hopefully I can answer. So today we're going to talk about bloating, so abdominal bloating. And this can occur for a couple different reasons. One reason is when you're having bloating or gassy or you're burping a lot, that can be a sign of gallbladder issues. So a gallbladder sits right underneath our liver, and what it does is it produces bile, and the liver produces the bile. The gallbladder helps squirt the bile out into our intestines, and it helps emulsify fat. So what that means is it helps break down fat so they're more easily absorbed, and our body can do what they need to do with them. And it's almost like if you have a dish or a sink, full of greasy dishes and pots and pans. If you pour some Dawn liquid in that water, then the grease just sort of disperses. Bile does the same thing, but if the gallbladder is not working correctly, then we're going to have a hard time breaking those things down. That's why a lot of people, after they have a fatty meal, they may have some upset because their gallbladder is not working correctly, or maybe the bile in the gallbladder gets sludgy and it's thick and it's sort of mucousy and so forth. So that's what can cause sometimes pain. Sometimes gallbladder pain can occur between the shoulder blades, more over to the right side, but it also can cause bloating. Another cause of bloating can be what's from SIBO. So SIBO is called small intestinal bacterial overgrowth. It's a big word, but it's an acronym. SIBO is an acronym for that. So small intestinal bacterial overgrowth. What this means is that you're getting bacteria in an area of your small intestines where they shouldn't be there, or there's too much there. We want the good bacteria and so forth to be down in the large intestines, but when it starts to come up, those bacteria work on different foods and sources and other types of sources, and it starts to break it down. But then when they break that down, there's a gas that's formed and it expands, and it doesn't really have anywhere to go. It can't necessarily go up and it can't go down. So what it does is it distends the belly. And if you have SIBO, a hallmark or trademark sign of this is after you eat, it's almost like you have to unbutton your pants. So it's like a Thanksgiving dinner, but it's just with a normal dinner. So some women will say that it looks like I'm 6 months pregnant because they have a belly. So the belly gets distended and it's very, very uncomfortable. So that's really, really a big sign that there could be SIBO issues. And a lot of times this happens when a person takes probiotics. Sometimes probiotics make them feel worse, or maybe they have kefir or yogurt, or these foods that have a lot of active cultures in them and probiotics in them, or maybe it's kimchi or sauerkraut. They cannot tolerate those foods, even though they could be good for us, but they can't tolerate them because it's producing too much gas. And there's certain tests you can do to determine if you do have SIBO, and there's certain breath tests where we look at the breath and it looks to determine if there's too much methane and other types of gases in the breath. So there are tests to determine this and diagnose this. And also what you do about it, you try to do an elimination diet, or what's called a FODMAP diet is one. It's FODMAP, that type of diet, to reduce the fermenting foods that we can consume, but then you have to really repopulate the gut in the proper way. So if you have any questions about that, you're coming in the office, make sure you ask me. We can do that test, and there's certain diets and plans we can help you with to hopefully remedy that, because it's not fun at all and it's not comfortable at all. So bloating, it's a common topic, it's a common problem. Gallbladder issues, and then also the SIBO issues can be major, major culprits. There's other things that can cause it as well, but those are very, very common causes. And hopefully, you can get help with that either from me or somebody else that does functional medicine type of work as well. Maybe ask your chiropractor if you're not in my area, but ask around. There is help for that. So hopefully this was helpful. Remember to include any comments, questions, or maybe topics you want to have me cover in the future. And I'd be more than happy to do that as long as I can answer those questions. So take care.